All right, we are now closing in on 9,000 cases of the coronavirus here in the U.S. That's because the state of New York has reportedly nearly 600 new cases this morning, sending the number of nationwide cases to over 8,900. Last hour, we reported the number at 9,500. That number has since been revised, an illustration of just how fluid, fast-moving, and chaotic this situation is. New York alone has nearly 3,000 cases, a third of the nationwide number, and more than double Washington State, which has the second highest number of confirmed cases. Joining us now, Governor Andrew Cuomo of New York. And Governor, if you could update us more accurately, if possible, on the number of tests available for New York versus the demand out there for the tests.
Sure. Good morning. Good morning to all of you.
Good morning.
New York's number is high, number one, because of our population, our density, et cetera. Also, we are testing at a very high rate. We did about 8,000 tests just overnight. And in this situation, the more you test, the more positives you're going to find. It is in no way reflective of the spread of the virus. I think the spread of the virus is well in advance of any of these numbers. So really what's happening is the more you test, the more positives you're going to find, especially the way you test, because we track down the positives, right? You have one positive person, and then you go down the line. So we did 8,000 overnight, which is one of the largest numbers I think ever done in the country, and that's good
great
news. But yeah, so we haven't gotten this morning's tally, but you're going to see it jump astronomically, I have no doubt, because we did so many tests.
So, Governor, we hear from medical experts that we may be 2-3 weeks behind. As far as these numbers, they're lagging indicators. These are people who got it 3 weeks ago. Can you, but your best estimates, by the best estimates of the medical experts that you've spoken with, if we're showing right now 8,900 cases in the United States, what do you multiply that in your mind? Is it possibly fivefold, tenfold of that number that we're seeing right now because of the 3-week lag?
It may be even higher than we're even talking about, Joe. We did some projections. We think here in New York, and remember, you're going to have different trajectories in different states depending on when it started, et cetera. But we're looking here at a peak in about 5 or 6 weeks. We're looking at about 110,000 hospitalizations, about 25 to 37,000 people needing ICU beds. That vastly overwhelms our healthcare capacity. And that's what this has been all about from day one, trying to reduce the rate of the spread to meet your capacity of your healthcare system. The best news is I think the federal government has now really gotten this, and they're engaged. This is a war. It's a different type of war, but it's a war requiring massive government mobilization, and only the federal government can do that. States can't fight wars. We did it once. It was a disaster. So you need the federal government. You need that capacity. And I was HUD secretary, as you know. I'm governor now. I know that a state cannot do this. I know the potential of the federal government, and the president stepping up, saying he's in, Army Corps of Engineers, Department of Defense. That's what we need to bring that kind of capacity. We have a real equipment problem. Ventilators are going to wind up being the great story when this is over. The way we needed missiles in world wars, we need ventilators. And we'll lose people without ventilators, believe it or not.
Governor Cuomo, it's Willie Geist. Appreciate you taking some time with us this morning. I want to ask you about something that a lot of people, at least in this city, are starting to believe is inevitable, which is a full lockdown, not just of New York City, but perhaps of the state of New York at some point, which is to say everybody stays in their house unless there's some kind of an emergency or their apartment. Mayor de Blasio floated that idea. He surprised some people at the NYPD when he floated that, I can tell you behind the scenes. You came out yesterday and tried to tamp that down and said, wait a minute, we're not going to shut down the place just yet. So what is your threshold where you say this is bad enough, or I see something on the horizon that's coming where everybody's just got to stay inside until further notice?
Yeah, Willie, 2 points. First, I make decisions based on the science, based on the data, based on the numbers. When the numbers go up, that spread is increasing, then we ratchet up the density controls, right? Because that's what we're really trying to do, reduce the density. We did it yesterday, we did it the day before, and we'll do it again today. But I think there's a bigger point. We're battling the virus. We're also battling the fear and the panic. And the fear and the panic, I think, can be worse than the virus. I cut my teeth on disasters down in Florida, Homestead, Florida, with Hurricane Andrew when I was HUD Assistant Secretary. I've seen panic. I've seen fear. And I am telling you, that is more frightening than the virus. And communication is very important. We've had mixed messages from the federal government. I'm glad the president is now fully engaged. But this chaos is feeding a panic. And when you get to a dense place like New York City, you panic people, you're going to have a real problem that you can't manage. And I'm telling you, the fear is spreading faster than the virus is spreading. And the fear is harder for us to deal with. So do I talk about density control?
Yeah.
Yes. Closing down businesses? Yes. I'm not talking about imprisonment of people in their homes. I'm not talking about quarantine and roadblocks where you're locked into a geographic area. That will explode panic in New York City.
So we're looking, as you're speaking, Governor, at a live picture of Times Square. It's just after 8 o'clock in the morning. It's rush hour, just a handful of cabs, no people out on a rainy day passing through there. I think most people are quarantining themselves effectively anyway, staying inside. So I understand and I take your point about fear and panic. But at what point do the health risks exceed your concerns about fear and panic? In other words, the idea that if anybody's out and about, this thing only gets worse from a medical point of view.
Yeah, well, let's go back to the facts, Willie. We are ratcheting up the density control, let's call it. Yesterday, I said no more than 50% of the employees of any business can go to work. 50% must work at home. And I've asked all businesses to keep their workers at home, and that's why you see the low level. But it's not that people can't go out of their homes, right? It's you can't be in a dense environment. Social distancing works and makes sense, and we have to do it. But it's not that you have to be locked down. You know, some of these terms are so confusing. Shelter in place literally meant in an active shooter situation or a nuclear disaster, find the interior room with no windows and stay there until you get the all clear message. You know, you're scaring the heck out of me, right? So, yes, density reduction. Yes, stay inside. Yes, social distancing. But communicate in a way that is comforting to people who are already confused and panicked.
Speaking of comforting people, you have twice commended the president, the administration in this interview, talking about how they seem to be engaged, how they seem to be understanding the gravity of this situation. Talk about that a little bit, because I know that you and the president have gone back and forth at the beginning of this crisis. He's tweeted about you. And yet, at least this morning, you seem to think that the president and his administration are starting to get their arms around this crisis. That would be comforting, I think, for a lot of Americans. Explain why.
Joe, to say we go back and forth is a very kind, sort of Floridian way to
Yes,
explain our exchanges.
Yeah.
I don't think you've had a governor who's been more aggressively opposed to the president's policies and more vocal about it than I have. And I'm proud of it, and I believe New York is the progressive capital of the nation, and I'll always make that fight. And when the president was not responding early on, I made that point also. I've had a number of conversations with the president. I spoke with him again last evening. You hear what he says publicly. Forget the politics for a second, Joe. We need the federal government to step up. We want to encourage that. We want to invite that. I said to the president, we need you. We need the federal government. I don't have the resources to do this. I can't build more hospital beds in 45 days. Only the federal government can do that. Only the Army Corps of Engineers can do that. I can't order manufacturers to build gloves and PPE and ventilators. Only the federal government can do that. So we want them mobilized because we can't fight this war without the federal government. And I said to the president, you step up. You help my state, you help my people, you help this country, and I will put my hand out in partnership 100%. Because politics be darned right now, right? This is a war, and depending on how we handle it will be how many people die.
And that's it. In terms of our readiness, Governor Cuomo, I know there's 2 military ships coming to the New York area, but it's going to be weeks. And I believe that's for people it's 1 ship to the New York area who don't have coronavirus being transported to the ship. But this is weeks away, if that. How are New York State hospitals right now? Are they ready? Could you use separate military or separate hospitals to deal with coronavirus cases? And if so, why is that not happening?
Yeah, a good question, Mika. Let's say we need 30,000 more ICU beds in New York. Intensive care beds, because the intensive care beds have the ventilators. The people who are coming into the hospitals need the ventilators. It's a respiratory illness. I am trying to get more capacity within the existing hospitals. I regulate them. I can do that. We need to build more hospital beds. That's the Army Corps of Engineers. They were here last night. I met with them. We're planning that. And we need the equipment. A bed without a ventilator does nothing for me. And that's where the federal government has to use its full muscle. That's the Federal Defense Procurement Act. That is the way we made missiles in World War II. You have to make ventilators now. General Electric makes them, Philips makes them, and that's what the federal government really has to help. Find the beds, but even more, find the equipment.
Governor Cuomo, Jonathan Lemire, 2 questions for you. We know about the drive-in testing site in New Rochelle. Obviously, in New York City, a lot of residents don't have cars. Are there going to be an equivalent here, perhaps a walk-in sites that can be open? And secondly, Mayor de Blasio has called for the military itself, beyond the National Guard, which was here in Manhattan yesterday unloading supplies, the military itself to be here in the city streets to help with the response. Do you want that as well?
Well, I'm using the National Guard all across the state, right? And they've been very helpful. And they're always helpful in disasters, by the way. Calling out the National Guard shouldn't send up a panic flare. I use them for snowstorms, floods, everything. They are the state workforce. Military help, yes. Army Corps of Engineers help us build hospital beds as quickly as possible. DOD assets, equipment, logistics, yes. Military personnel, if you're implying on the streets, no.
Karine Jean-Pierre has a question. Karine?
Hey, Governor. Yesterday, you signed a bill that guarantees New Yorkers get paid sick leave. Can you talk more about that?
Look, this crisis works on so many levels, and one of them is just economics long term, which is going to be a whole situation in and of itself, but short term. And paid sick leave, which I supported before this anyway, is now so abundantly obvious that we have to pass it. We should pass it nationwide. We passed it in this state. And I've quarantined about 10,000 people. Paying the people who we have quarantined, both mandatory and voluntary, we think is essential just to stabilize the economy now. And paid sick leave and quarantine pay go a long way. I hope the federal government passes the current bill, which would actually give Americans some money in their pocket to buy food, just to stabilize the short-term situation.
All right, Governor Andrew Cuomo, thank you very, very much for being on the show this morning. We appreciate it.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.